So how do we decide what issues to work on? We partner with communities to conduct comprehensive community health needs assessments. In our last assessment, Chelsea, Revere, and Charlestown all identified substance use, particularly the heroin and opioid epidemics, as their top priority. And by the way, we are starting to do this work in East Boston as well through a partnership with the East Boston Neighborhood Health Center, and they too identify that as their leading issue. So at CCHI, we redoubled our community-based prevention and early intervention efforts. But it didn't stop there. The entire hospital took notice. As a result, a comprehensive new initiative on substance use disorders is the leading clinical priority of the entire hospital's strategic plan. This is a big deal for a community to have such an influence on the agenda of a major academic medical center. This initiative is a collaborative: medicine, psychiatry, the emergency department, nursing, social work, community health, and many others. The goal is to approach addiction like any other treatable chronic condition, like hypertension or diabetes, while working to alleviate the shame and stigma that often prevents sufferers from seeking the care and treatment they need. So the initiative spans from the bedside to the community. But today we're going to focus on a key part of this initiative, which are recovery coaches. Recovery coaches are peers in recovery themselves who assist patients with whatever change they are ready to make in their lives at that point, whether it's finding housing, dealing with a court issue, or seeking recovery support. I would like to introduce to you one of those recovery coaches, Nicole Bourgeois. Nicole is a lifelong Charlestown resident and patient of MGH Charlestown. She has graciously agreed to share her story of addiction and recovery with us to illustrate the life-saving importance of this new initiative. Thank you, Nicole.
Hello. Thank you for this opportunity to tell my story. I grew up in Charlestown, the oldest of three in a good home. I can look back now and say I grew up in an alcoholic home that wasn't active. Neither of my parents drank or did drugs, but they grew up in homes where that existed and never sought treatment. I know today everything that happened to me was no one's fault, that I have a disease. I grew up suffering from internal peer pressure, but also seeking negative attention in any way I could. My cousin Ryan growing up was my best friend. I looked up to him. He was 2 years older than me, and if he was trying something, I had to too. I had my first drink at 10 and my first Klonopin at 11. By the age of 13, I had tried everything: cocaine, angel dust, ecstasy, acid, Special K, except heroin and crack. I didn't think I had a problem. That's what everyone around me was doing. I went on to graduate from Boston Latin. I used everything I could get my hands on the entire time. I got picked up for shoplifting and causing trouble, but the cops always took me home because I was so young. I even worked throughout high school at different jobs, including a daycare center. I was always high, often with my cousin Ryan. I remember thinking Charleston was my problem for the longest time. So I thought if I went to college far enough away so I did not have to go back, I would be okay. But I also wanted to go somewhere close enough so I could return home. I was already setting myself up to go back to the place that was my problem. Little did I know, I was the problem. I attended UMass Amherst, although rarely went to class. This is where my drug use really started to escalate, and I began to inject heroin. I still didn't think I had a problem, but after 5 semesters, I left school and moved back home because my addiction had really taken over. This became a difficult time for my mother and I. She had tried numerous times to help me, but unfortunately, I did not want the help. She had to learn how to let me go. She kicked me out, even though I know now her threats were probably just that, threats. I stayed away and lived on the streets. For 3 years, from 19 to 22, I was homeless off and on. I lived in numerous places a young girl should never live: project hallways, train stations, and at the end, under the T-stop right in front of Mass General. I spent a lot of my days inside these facilities trying to stay warm and dry. I was sent to Framingham State Prison for a few months. I opted to go to a halfway house at discharge because I thought it was a way to get access to drugs sooner. The director and counselor there were from Charleston, and I thought they might look the other way. but instead they put a lot of strict rules in place. It was also made clear to me that I was accepted into this halfway house as a favor from my mother. They didn't think I was ready to change. Motivation for change is different for everyone, and that did it for me. I said I'll show them to myself, and I did. But I couldn't have maintained my new sobriety without all the support I got from my community. I believe you need to get sober in your home community in order to stay sober, because home is where the heart is. Shannon Lundeen, the recovery coach supported by the Mass General Center for Community Health Improvement, was critical to me in those early days. Going to meetings and some of the events that were starting to be created around the city were extremely helpful. That is also when the Charleston Substance Abuse Coalition was being formed. With support from CCHI, and it made such a difference in my community, was coming together to say no. This isn't normal or the way it is supposed to be. And my doctor, Dr. Jim Morrill at MGH Charleston, made all the difference. He showed me compassion when no one else did. Dr. Morrill gave me the choice to make decisions for myself, always making me feel like I was part of my treatment plan. When I was offered this job, I said I wouldn't take it if I could not see Dr. Morrill anymore. Finally, I also saw Dr. Arthur Kim, who treated me for Hep C. He gave me the knowledge about Hep C, and at that point in time, I thought I was living with a death sentence. Dr. Kim explained to me I could be treated, and he, like Dr. Morrill, always showed compassion and was never judgmental. Because let me remind you, I met both of these men when I was still very active in my addiction. I am pleased to say Hep C is no longer detectable in my system. In the meantime, I went on to graduate from UMass Amherst and am now enrolled at Cambridge College for a master's degree in mental health counseling. When I heard that Mass General had this new initiative on substance use disorder, I knew I wanted to be a part of it. In 2013, my cousin Ryan died in this hospital at age 32 from endocarditis, which is an infected around the heart that enters from injection drug use. It was the hardest thing I ever went through in my life. We watched him die for 2 months. People suffering from this addiction don't really know about endocarditis. I try to work with all the patients here who have endocarditis to let them know the danger so there won't be another Ryan. Mass General has played an important role in my life. I know that people change because there was a point when I was banned from this hospital for stealing out of the gift shop or cafeteria, and now I work here. I can say that Mass General has played a huge role in my recovery, meaning doctors that have supported me and helped me when I did not want to help myself. I am proud to say that I am associated with this program and to work here. And I am also proud to say that in 2 days I will celebrate 9 years of sobriety. Thank you.